Dr. Darj, let's talk about gum disease and, or periodontal disease as it is called. Basically the flesh rotting away somehow. Now, here's what I constantly hear dentists saying, and I have a slightly different viewpoint on that, and you correct me how wrong I am or how right I am. Dentists keep telling their patients and say, if, you have gum disease and if you don't fix it, you will lose your teeth eventually. 1 year, 5 years, 7 years.
Yes.
Depends on how fast it advances. Like with cancer, nobody knows really, when it accelerates, blah, blah, blah. But you will eventually lose them. And while this is bad, while this is true, it happens down the road. And after all, you dentists are very good in making great implants. So what's the big deal? Costs money, but it can be done. We're not living in a time where George Washington had a wooden tooth in him, and that must have been awful, if it is even true. Is it true?
I'm not sure. There is quite a bit of speculations, but I can't see wooden teeth working for a very long time.
Right. So the point is, you guys do a good job. And so rather than money, and maybe some people might have the conception, and they might really be true. It might be true that 5-6 years down the road, they do have a lot more money. Do you know what I mean? It's very possible. We're career people. We go and say in a few years, I can spend 15, 20,000 much easier than now 2,000. We sometimes think like that. Usually it doesn't come true. At least for me, it doesn't. It's always the same. But here's the real bad thing which happens, in my opinion. When you have a gum disease, you have an infection in your mouth, which is right next to the gateway of the blood vessels. We know when we take vitamin B12 or something, it dissolves under the gum. Why? Because boom, it goes right in the body, and we go, ooh, I'm alive again. So you have that infection, that yellow, ugly, reddish pus. It drips into your mouth. It gets mixed up with your food into the stomach. It goes from there. It goes into your blood. Half a foot to the head, half a foot to the head, to the heart. It clogs it up. I have heard there is babies who are premature, delivered from women who have gum disease. Even in California, 1 or 2 of them died. Babies, they found the yellow pus in the placenta of the woman. It just looks to me that is much worse than losing your teeth. Yes or no?
Yes, absolutely. Gum disease is an infectious disease. It needs to be dealt with immediately.
Okay, so what I'm saying here is true. It's like an infectious disease. Let's again elaborate on it, because this is where, if people would have an infection which is like big like a dime or a quarter on their hand for a week, 2, 3, 5 weeks maybe, and if it doesn't go away, they would run to a dermatologist right away, as they should.
Yes. Yes.
But they have a huge infection in their mouth right next to the blood vessel, much more accessible to the blood than on this thing, and they don't do anything.
Because, years ago, a teacher of mine said, people don't expect when they comb their hair for their scalp to bleed. But when we brush our teeth and our gums bleed, we think, oh, well, that's normal. I might have brushed hard. But that is the first sign of infection. It's a gum infection. And it travels not only through our mouths, through our food, and through our stomach. It travels in the crevice between the tooth and the gum to our blood vessels, and all of that pus and inflammatory response affects our heart, affects our kidneys, affects our babies, affects our brains. Gum disease has been linked to shorter lifespan. If you take a one of those aging tests, they'll ask you, do your gums bleed? And right there, they chop off some years off your life. It's been linked to early memory, short-term memory loss, and all kinds of other diseases.
Right. So because basically any infection brings the immune system down, right?
Yes. Yes.
Which is, I think, why I read that in a journal from Japan, some Japanese university made a study that if a person has the HIV virus, which in itself is just a virus there, but doesn't get you the AIDS. I mean, yes, it does, but it doesn't have to develop into AIDS. But if a person has gum disease, the chances for him to get the AIDS from the virus is much, much higher, simply because the immune system is low. Now, thanks God, most people don't have the HIV virus, but with immune system down means easier cold, staying home from work, not being so active, being cranky with your spouse and with your kids. It means all those things, doesn't it?
Absolutely. It means fatigue. It means your whole body system is trying to fight this infection, so it cannot function normal. It cannot attend to its normal daily routines because it's constantly fighting this germ that's swimming through your blood.
It's a little bit like if you fight 3 wars already, it's unwise. If a fourth one starts, something has to give. You don't have enough soldiers.
Absolutely.
To fight.
Right.
Is it true?
Very right.
Is it true that people who have a slight disposition or deposition to have diabetes, that they are extremely heavily affected by a lower immune system and by gum disease?
Absolutely, because their body is already running on reserve, and add to that a little infection in the gums, and they can't heal because the immune system is already low, and the gum disease just takes it over the edge. They're prone to a lot of gum infection, yes.
Now, lately, the last few years, strongly, a little bit always, but the last few years very strongly, I have found out that there's a tremendous amount of surgeons, the guys who do hip replacement or appendix or tonsils operations, those type of guys, that they ask for a clean bill of oral health. And by that, they don't talk about cavities, they don't talk about being straight teeth and having a Julia Roberts, Tom Cruise smile. They simply talk about no gum disease. Because if there's a gum disease present, they have found that their surgery, whether it's appendix or a knee operation, could fail, and the patient could even die because the infection brings him down so far if he has it. And they become very alert of it lately. Have you found that to be true?
Yes, we have a number of patients who are referred to us for clearance because they're waiting. They need to get on the list for all kinds of transplants. They cannot get on the list for those transplants unless they're gum disease free and decay free, of course. But gum disease is a major importance for surgery.
Well, an infection is an infection is an infection, and if it happens at the core of the source of the blood vessels, where it goes right into the bloodstream, it's like an infusion of injection. It's almost like, hey, here, let me give you an injection with a little bit of infection in it, because you put it right into the blood vessel. Well, all right. So look, you said that you have a couple patients who are more than 100. So they're gum disease free, aren't they?
Yes.
All right. Beautiful. Thank you very much.
Thank you.